health outcomes for our rural and remote communities, are significantly behind our cousins, colleagues in capital cities and large regional centres. So the maldistribution of our medical workforce is real. We're certainly, looking at numbers, the mid 400s per 100,000 population in capital cities, a little bit less in our large regional centres. But when we get to our rural communities, that actually drops to about 236 full-time equivalents per 100,000 population. So the maldistribution is real. And we do need to put not just one incentive, there is no silver bullet to this, but we do need that package of incentives, supports and programs to encourage and support more of our, new Australian graduates to choose a rural career in medicine.
And so just for people in cities who might be watching now, give us an idea of some of the challenges that there have been and there continue to be for people in regional areas because of this shortage.
Well, I think, we're seeing things like in New South Wales, we've heard lots of stories about where they've really tried to recruit a doctor, haven't been able to, and we end up with a telehealth only service. So, and that's including, the hospital emergency service. So that becomes a real challenge. These issues are real. And what we do see is that people often may choose not to or elect not to have, certain treatment because they actually have to leave their home to access that care. And, rural communities, they understand that, not every rural community is going to have a neurosurgeon or a cardiovascular surgeon. We understand that. But certainly with access to a GP and emergency service, being able to have your baby locally is critical in relation to making sure that, there's good health outcomes and access to a range of health services that we should be able to expect in any community.
Yeah, so there have been many efforts to try to get more doctors and nurses to the regions over the years. What do you make of this one announced today?
Well, we certainly welcome it. We think the design is actually quite clever. It is looking at how where people are up to or where, junior doctors are up to when they're making decisions about their career. They will still have, for many of them, a significant help debt hanging over their heads. And particularly for those that are interested in general practice or rural generalism, that, they can go rural, spend their time, do their training, and actually just by doing that, they will actually eliminate their help debt. And for some people that are thinking about anaesthetics, there are opportunities to do anaesthetics in rural communities as well as obstetrics, as well as surgery. But combining that as a rural generalist and doing some work in general practice is the key.
What about the requirement to work in the rural regional area for the equivalent of the length of the degree? Is that at least 6 years? And do you think that with that condition, this will really attract more than we're going to go anyway?
Look, I do think it opens people's mind. I think people will, or the medical students, the help debt is a significant financial burden that hangs over, medical students or junior doctors' heads once they've finished medical school. So
and
I think,
Peter, I'll just pick you up on that just for people who are watching. What is that generally at the end of a medical degree? Is it $100,000 or more than that, or?
It can be up to about $155,000. Yeah. So it's a significant amount. In their early years in the hospital system, which are often in bigger centres, they will have to pay some of that back. But by the time this sort of program kicks in, it's still, for some of them will still have a debt exceeding $100,000. So it's not small bickies. And then when you consider that in conjunction with other support programs, initiatives and training programs, you can actually create a really competitive and rewarding remuneration package and career.
Yeah, so you think it will attract more than we're going to go anyway?
I do think that. I think people will start to have this on their radar as they start to make decisions about training, as they start to make decisions about where they will do their training, particularly as a GP or rural generalist. The large regional centres, the likes of Townsville, Toowoomba, Bendigo, aren't eligible under this program. So what we will see is rather than maybe doing your GP training in those communities, you'll actually, they'll make the decision to move out a little bit more rurally and hopefully for some of them more remotely.
So you're happy with this initiative. What else would you like to see on this front?
Look, we continue to talk with government about increasing the opportunities, particularly in those junior doctor years that are currently spent in large tertiary hospitals or major regional centre hospitals, where they're really getting very little or no rural exposure. And those years are really formative about what will influence their final, training or career choice. So we think it's really, really important that they do get that rural exposure, and not just about general practice and rural generalism, but to also understand that there are other career opportunities like surgery and, medicine and anaesthetics and paediatrics. There's a whole range of other careers available in many of our rural and remote communities.